Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair, just sticking out. Oh my God!
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'll do it again.
Events to be remembered and retold for generations to come.
Pandemic babies.
Okay, well, this is the outworkings of COVID. This is what happens when you don't go to the barber for 6 months. I haven't had curly hair since my 20s, and that's a long time ago, I can tell you. The only thing that frustrates me is the grey. You're just a reminder that actually you're a bit older than you think you are. You might think you're Brad Pitt, but you find out you're Danny DeVito, you know?
It's 1 a.m. Ciara arrived at the hospital half an hour ago in active labour. This is her second child. Her sister is also expecting a baby, so grandmother Christine will have a very busy household.
This baby now will be the 8th grandchild, and number 9 will be here now shortly. We haven't even pushed 8 out when we were informed about 9, you know?
We're both Scorpios, so we clash, but
So long as she does what she's told.
we have a great relationship. I kind of depend on her for a lot.
I'm Jenny. Nice to meet you. I'm going to be looking after you upstairs. So we're going to go up now whenever you're ready. Okay?
I was dreading telling me ma I was pregnant again.
She waited till I was driving the car.
Just so she couldn't swing for me.
Come on in. It's your room now.
I didn't let you finish the sentence, and I says, don't even say it, Ciara. Don't even say it. Didn't I?
Yeah.
Yeah, I knew what was coming.
Breathe the pressure away. Well done.
She was at a stage in her life where she could have went back to work, and she could have...
She wanted
You
me
know.
to go to do things.
make her
and-
dreams,
Yeah.
you know. Just think every pain is a bit closer, huh? You'll be happier if you're doing something that makes you happy, that'll brush off on your children.
When I
And
get
that's the
time-
message you want that your kids to have too.
When I get the time to do it, I will.
Don't have me saying it now, you know. I had 4 years and 2 jobs.
This is what we hear about. Even my stepdad's now turning around saying she had 4 kids and she had 2 jobs.
You do.
Well done, Ciara.
What a stink.
I have a spray.
It's okay. You're doing a great workout here. You should have wore your Fitbit. It's okay. Ciara decided that she was going to do the labour with no pain relief. It's very rare we get to see a natural birth with no pain relief, and even the support of her mom, you know, the support of Christine, like we don't get to see that often where it's a mother-daughter combo in the delivery suites.
Oh,
Well done.
when are you allowed to push? Like, when the... Oh.
There's your water's gone.
It's gone.
Well done. She had the sheet over her, so I didn't know that they had gone until she was like, my waters are just after going. So calm, you know. And I was like, okay, well done. Well done. That's great progress. Obviously, I know it was her second baby, so if the waters go like that, usually baby arrives soon after. I don't know how you managed to keep the socks dry when the waters went, but you did. Kristen, we'll just get everything ready to go.
Okay, you're doing great. You're doing great.
Yeah.
It's a super moon, is it?
It's a super moon, yeah. But it can be called the flower moon and all that. But the hair moon is the nicest because it's like fertility and rebirth. hare moon, and it's the hare looking at the moon, which is not to be mixed up with a rabbit because rabbits love to have sex so much.
Michelle and Clive are in the hospital today for their 20-week scan. The couple met 12 years ago when Michelle was 18.
I knew from a very early age myself that I wanted children and I wanted to be a mum, and a few years into our relationship I started to make that very obvious.
I said to her that we're not having kids until we get married and have a house.
That was the deal.
We did all that in a year.
After 8 years and numerous failed IVF treatments, Michelle became pregnant. Unfortunately, at just 24 weeks, Michelle went into labour and their baby, Zach, was born extremely premature.
Came out, no sound. They had to resuscitate him, and then we heard kind of like a little bark.
A meow.
Yeah, a little meow. And he was born. Now he was translucent, he was see-through. He came over for a little cuddle, and then he was whisked away.
Hello, Zach. Look at you. Are you giving out? Oh, look at you, gorgeous boy. Oh, baby, sorry. Sorry, is that too bright for you? Hello, my Mr. Moo.
There was more positives than negatives at the start. He was getting bigger, but when you were in there was other babies coming in and they were 10 times as big as he was and stuff like that, like, you know, and
We call them the giant babies.
the giant babies. Close up.
Hello. Oh, look at that face.
Oh, hello, little pal.
Whenever we speak with parents about an infant born at around this gestation of just under 24 weeks, we of course have to always remain hopeful. However, at the same time, we must also remain realistic, because there can be a lot of complications that can happen throughout their stay in the neonatal intensive care unit.
Did you give him a kiss?
No, I don't really want to. I'm uncomfortable.
Give him a kiss. Hi, Zach. Oh, Mama loves you. Yeah.
After 5 weeks in intensive care, Zach passed away due to complications of his extreme prematurity.
The saving grace of it would be that we got 5 weeks from him, like, you know. We understand a lot of people don't get that.
Leaving the hospital with no baby and being on maternity leave and having to get through that time that all your hopes and dreams were supposed to come true is just, it's the most difficult thing I've ever had to go
It's
through.
heartbreaking. It's absolutely heartbreaking. Walking out of the hospital with your son in a box is not fun for anybody. But he's always with us. Everything we do, he's a part of it.
You can make that out, can you? See the little face? Yeah. Gorgeous.
It's been 3 years since Zach passed away. Although delighted to be expecting again, Michelle and Clive are taking every precaution to avoid another preterm labour.
I just always remind myself just to keep hoping for the best. You know, like, I can see good things coming, and I'm nearly afraid to say things like that out loud, because I'm terrified that if I say something, you know, am I jinxing it?
When Michelle was about 14 weeks pregnant, I put a stitch into the cervix. So this is something that we do in patients who we suspect of having an incompetent cervix. So these may be patients who've had a previous very preterm delivery. And then you can see the stitch here. See that little white? That's at the end of the stitch. The hope is that the stitch is going to keep the cervix closed and prevent a preterm delivery. Ideally, we would like Michelle to get to 37, 38 weeks gestation, but obviously the main thing that we want is to get to a point where the baby will survive.
Thank you. Oh, look at this one.
We do a bit of everything. It's probably one of the only shops that you will get a bottle of Coke, a chicken fillet roll and a breast pump. At the moment, it's just Daddy on his own coming down. You know, he'll just buy the few bits he needs to buy and back up because he's conscious that they're only allowed there for a certain amount of time. You really miss the atmosphere of having the family members downstairs. Pre-COVID, when you have visiting allowed, and you know, you might see one nanny going up and buying her balloon and teddy, and then the second one go up and buy a slightly bigger one.
Dark hair on this baby.
In the delivery suite, Ciara's labour is progressing very quickly, although not quite fast enough for Ciara.
When is she gonna just come out?
Both Ciara and her mother Christine are eager to meet and name this new baby girl.
I came into the Rotunda and got the scan and found out I was having a girl. I was really hoping for a boy. I thought I was having a boy because it was totally different pregnancy to when I had Mila. I had to think of girls' names then.
I said, you're going to be in such pain that you're not going to know what's going on. And when they ask what the baby's name is, I'm going to say Christine. Come on, little Christine.
Yeah, I didn't want Christine.
She said, no.
See what way the baby is facing. Good position for delivery.
Well, I start showing her Shirley Temple films, so we put Heidi on.
And I loved the name, yeah. I loved Heidi then from that. So I ended up going with Heidi.
And you're fully dilated.
You're fully dilated, so you know, this is it, Ciara.
Well done. You might go out and tell Juby that I might have time to go to break. You go in there knowing that you're either going to get your break at 1 o'clock or you're going to get it at 5, and you just adjust to it. What can you do, you know? You're there to deliver the baby, like that's your responsibility. That's what you're going in to do, you know? You can't just say, I'm going for my break now. At the end of the day, that's our priority, to have a safe mother and a safe baby in labour. Yeah.
This is it.
Just go with it, Ciara, okay?
Go on. Go on.
You're doing a fantastic job.
Go on. Go on.
Love it. Well done, Ciara. The urge is there, just go with it. Well done.
No. The pain is just unbearable. Like when you're getting them contractions, it's just, you feel like it's never going to stop. I felt like just exploding. I just wanted to be thrown out the window. I would have much preferred that at that time.
Well done. If the pressure's there,
I
just
just
go
want
with
a
it.
C-section.
No, you don't. Oh my God. You're mad. You're doing amazing.
You're doing great. This will be all over shortly.
When women are just about to deliver, they can just lose complete control. And I suppose we have to be the people there to reassure them that it's going to be okay and that they're going to be able to do it.
No, you don't. No.
Ciara, you're so close now.
You're doing great.
You've done all the hard work up to here.
You're doing great. Do you hear me? You really are.
Amazing.
You're doing great.
You're amazing.
You're doing great.
Okay, 1, 2, 3, go. Rotunda's fit as fast.
Not to laugh, huh?
Yeah.
Rotunda's fat as midwife.
How long did you do it for the last time?
Don't know. All I know is it's a bit sore.
You're getting a bit shaky there.
Did I tell you I had a sore back?
Oh yeah, that's probably not the best thing to be doing.
No, it's not.
Clive and his wife Michelle have been worried about the possibility of having another preterm baby. Their son Zach died after complications due to his prematurity. With this pregnancy, Michelle has already reached 34 weeks.
What we've been told in the last few weeks is that he's 5.5 pounds now, so he's not going to get any bigger. We're just trying to keep him in the oven so he cooks a bit more and gets a bit fatter.
Michelle has a scan in the hospital today. But in line with COVID safety guidelines, Clive can't accompany her.
I'd like to be in there. I was kind of one of the lucky ones to get in for the big scan, the 20-week scan or whatever they call it. And then I know after a few weeks that they stopped that for a while, so I think that's a bit harsh on the parents, but overall I think it is the right thing. Like less people mixing together, especially in a tight room.
A lot of parents don't want to actually come back to the place where their child died. After Zach passed away, Michelle and Clive, they actually went ahead and started fundraising for the Rotunda Foundation, which is our charity arm of the Rotunda Hospital. They raised in excess of €15,000 for the neonatal intensive care unit. And to have that, resilience and dedication to their son, I think, is a great legacy that Zach has left behind.
They'll never forget the trauma they've experienced, of failed IVF cycles and of losing a child. But their dreams of bringing a baby home are beginning to feel more secure.
Before Michelle got pregnant, she turned into a tree hugger. That's all the only way I can describe it. She was doing these beach walks and 4 o'clock in the morning she was getting up out of bed and going to the beach and doing skinny dips and all this sort of stuff, or whatever they call it. She got into meditation. She was just kind of calling the earth, to be honest. That's the only way I can describe it. Nothing to do with me, but it worked. She just kind of became really relaxed and loves her job, and life was good. And it's funny because we were going to do IVF, and the week we were going in for IVF, she kind of found out we were pregnant. Like, you just wanted to be normal. Do you know what I mean? Just have the baby, have a few days in the hospital, make sure she's recovering well, and just go home, bring him home. That's it. Baby's not coming now, no?
No, he's not coming yet.
Right.
Yeah. We have a date.
Oh. Straight out. Now
Straight
start.
elbows.
Okay.
Okay.
Go.
Oh! Stop! How long did you get?
2 minutes.
Oh, you got about a minute and a half, did you not? No.
You got 12 seconds. If you were.
I'm hoping that you're 5 or 6 centimetres. You don't. It's 13 pounds.
Oh, well, that's probably why.
Yeah. Well, I was off as well, though.
That's it, Ciara. Go on.
Oh! Ciara's labour is still progressing very fast. Her mum Christine has had 4 children of her own. This is her first time being a birthing partner.
See the head there, Christine?
I couldn't see the head. And I kept thinking I was looking in the wrong place.
The baby has loads of dark hair.
Oh.
Dark hair on this baby.
I thought that was her private parts.
Oh, Mary, Mary.
Well done. Okay, Ciara.
But it was only wherever way the baby turned the head.
And then she's all Ciara.
No! Go on, Ciara. Keep with it. Keep with it.
Push down, Ciara.
Go on, Ciara. You can. Go on. Push. The hardest push ever, Ciara. And he should be here. Go on, Ciara. She's just out. Ciara, keep pushing. Oh my God!
Well done.
It's a magical feeling when they get put on your chest and you're seeing them for the first time.
Well done. Excellent.
Look at her.
She wanted to do it herself, Ciara, and she did it. No epidural or anything. She just had a analgesia-free labour, and she was amazing.
Hey. Oh, you really have to give him the finger. The minute she came out, you sort of...
I snapped back.
Yeah, it was like you
just wanted a shower. That's like me on both my pregnancies. Just wanted up and into the shower.
And then you can have a shower and all.
Yeah, can I?
Yeah, you can, yeah. Yeah, it's just too far away for you to labour in the shower. Yeah. And thank God you didn't get into it because we would have had the baby in the shower.
Yeah.
We would have, wouldn't we?
We would have. And you still didn't get your break.
Oh, God, I'm grand. Sure, I got a baby.
I will go back to work. Mila will be going to school soon, and Heidi will go into creche or down to our nannies. And I'll go get myself back on my feet and start up my life, adding to my life. Yeah.
God, she's a guzzler.
Did you get a photo of her? Don't get me, just get her.
No,
Ciara, you
you're
look
lovely.
great. I don't know what you're talking about.
Right, smile the twos.
I've seen really good times and not so good, obviously, in the last couple of years. Wearing masks and PPE every day is exhausting. Having to walk in through the door wondering who is asymptomatic and who doesn't even know that they have it. Seeing your colleagues getting COVID while you're working is Quite distressing for everyone, and it's just added stress that you don't really need, but you've just got through with it and just done it.
Now 37 weeks pregnant, Michelle came to the hospital today to have the stitch in her cervix removed. Her waters were then broken. After this, the position of the baby's head changed and the decision was taken to deliver this baby by C-section.
Because the waters were broken, the risk was that the cord could also come down alongside the hand, and obviously that would be very serious if that happened.
Michelle's husband Clive was at home. The last thing he expected was a dash back to the Rotunda to be there in time for the birth.
It was the second phone call that kind of scared me, going, oh, what are we in for now? Because obviously from the previous what happened.
Hi, this is Annette in delivery suite. There's a guy coming called Clive. Will you send him straight up to the theatre to us on delivery suite? Grand, perfect.
Well, all exciting now, isn't it?
But you changing the
Yep. I sat on kind of a bar stool thing beside Shell and just gave her a little kiss and said everything all right, and then a nurse came up behind us going, your baby boy's about to be born.
Yep, lots of pressure now. Hello, baby.
It was literally, arse was on the chair for 2 seconds. The baby was here, so yeah, madness. And then it was like the Lion King straight over the little thing.
I can't even describe how I felt. I couldn't actually even see him properly through my tears. I just felt like I gave the first breath that I've taken in a long time. Like, I just felt massive relief.
Oh, I'm sorry. I know you were all cozy in there and we just plucked you out, didn't we?
It was literally a dream come true. It's something that I had imagined in my head for so long. I always believed I'd get there, and just being there and being in that moment was just incredible.
Well, it's definitely Rio, is he?
It's definitely Rio.
That is beautiful. It suits him so much.
Yeah, and we just have Zed for his middle name.
What is it, Zed, is it?
Yeah, Rio Zed Ross.
After that?
Yeah.
Oh, lovely. That is gorgeous.
He looks so like Zed.
Does he?
Yeah.
So well.
Thank you very much.
Leonie and her partner Dan have been in the delivery suite for the past 2 hours. They have known each other since their teens.
We first met each other when we were, I think we would have been 17 or so, yeah. I wasn't the type at the time to wear.
He wasn't ready. I seen him and I was like, oh my God, I was like, I like him. I'm just gonna go for it. And I just like, I was gonna go over to him and I was like, hey, I was like, my name's Leonie. And he just like, he was in the middle of a conversation with his friend and he was just like, I was like, right, I just got pied, nice.
Yeah, I knew she was a beautiful human being and I could not break a beautiful
He just
human
wasn't
being's
ready.
heart.
He was still in this kind of like, you know, party stages and all, and he just wasn't. It's like, I'll save her for later.
I was more focused on the soccer at the time, I was. Then she trapped me. But yeah, I wouldn't leave her side till after that then. She became me baby, didn't she?
A year ago, they moved in together, but they weren't quite ready for an instant family.
It wasn't planned to have
twins. We're not that good.
I have two. Two little babies.
Oh my God, really?
Yeah.
The day in question that Leonie was saying that she found out about the twins, I was up a ladder and she called me.
I know, it's exciting news, isn't it?
Oh my God.
I thought Leonie was trying to wind me up. I was like, you stop, lad.
Yeah.
And then
For like
she
constant 5 minutes. Give it over, Leonie. Like, come on, like, you know, is the baby all right? And the babies are okay, Dan. Like.
Is this number 2?
Okay. 2 babies or 3, did you say?
2.
Okay.
1 and 2.
I was like, 3 is more than enough.
I came down off the ladder and then I got a video and then I kind of just broke down in tears.
To comply with COVID safety guidelines, Dan could only be present for some of Leonie's scans.
It's difficult enough finding out you're pregnant and your whole life is changing, but to do it on your own, like with the appointments, stuff like that, like it's a big moment.
It's a special
like,
moment,
yeah.
you know, and I know it's like for single babies even it's a special moment, but to find out like for both of us to know that we're gonna have twins and in shock that we wouldn't even thought we were gonna have twins, like.
I won't feel these babies pushing out now, will I?
So you'll feel the pressure of your contractions. And that's normal. You want to be able to feel the pressure because you need to know when to help with pushing and stuff, okay?
There was one Saturday morning when we were working in the lab, we heard chainsaws going on, and there's a tree. The lab are very fond of it because it's the only thing green we can see from the lab. The guy had a chainsaw and he was cutting it down. I kind of said to him, I said, you do know you're cutting down a historical tree. And he kind of stopped then and looked at me, and I kind of said that in 1916, the leaders in the GPO were brought up to Rotunda and held in Rotunda, and they were chained to that tree. So he stopped cutting down the tree. I completely made up that story about the 1916 leaders, but it worked. The tree still stands.
Sara and her partner Vishnu are expecting their first baby. When Sara's contractions started, she was determined to stay at home for as long as possible.
I had a very strict idea in my head that I would be able to do the majority of it at home and then just kind of show up for the big finale in the Rotunda.
I know, she's very good.
We met in college. We met in 4th year in
You're not telling it right.
See, this is what happens all the time. When I start telling a story, Sarah would be like, no, you're not telling it right.
Hey Sarah, how are you? I'm Sharon, this is Freya. I'm taking care of you. How are you getting on?
So we met before 4th year. We met when I was in 3rd year.
Oh yeah.
Yeah, and Vishnu thought I was really obnoxious, and I thought he was kind of had to stick up his arse.
Sit. Well done. Well done.
Okay, take your time. Over a €2 coin for a glass of wine or something like that.
Yeah, I was a treasurer of a society in college, and I was in charge of making sure that people were paying their dues when they came in to drink the free wine.
Which I paid to Bridget Rankin.
But I didn't know this. Tiny little booties.
Oh gosh.
Did I ask you to leave? I can't remember.
No, you didn't ask me to leave.
No. Sarah's making a show of herself, so I think she automatically left after a while. But that was our first kind of meeting. That was 11 years ago.
Can't get rid of me, I'm like a bad rat.
You.
My fucking back is fucked.
Do you want to try on your knees? It would take the pressure off your back.
Yeah.
If you want to try it, and if you don't like it, we can always go back. You can still use the gas as you wish. Yeah, and you can go right at the bed there.
Oh my god, no, that's so much worse.
Is it?
Oh my god. I was in no way prepared for how painful it was. Absolutely not prepared for how painful. And how quickly it got really painful as well. Like a lot of people, I had been like, nah, I don't need an epidural. Like,
I got this.
I got this. I'll be fine. Like, I squat. I can do this. I think I'm going to go for the epidural, please.
Yeah.
And thank you.
No worries.
Wow, they're lovely flowers, aren't they? That's gorgeous. It's lovely.
No. Try getting your head down, Dad. You're up too long here.
Leonie and Dan were delighted to discover they were expecting a baby. But at the time, they'd no idea it would be twins.
I think the first time that we done the test, Leonie, when she was on her own, I think I had the 2 lines. So Leonie's like, oh, I'm definitely pregnant. And when we actually realised, now that meant you were having twins, so we should have known the whole time, but we actually didn't.
That doesn't mean you're having twins.
Doesn't that know?
No. That's just...
You'd have a couple of bleeding lazy boys, like, wouldn't you? PlayStation or something, you know?
Leonie has been in labour for over 10 hours now. It's taking a lot longer than they'd hoped.
Fair enough.
All right. It's okay if I go ahead? Yes. So, a little bit of pressure, my love.
Probably still 4.
Okay, yeah, so 4.
4?
Yeah. Okay? 4. Yeah.
You look around the walls, you're going, right, like, when is this baby going to come? So Dan's like, will we do a few bets on your phone?
I was just trying to amuse her.
Yeah, why not? Like, come on, let's do it. Like, what else are we doing?
One of the jockeys fell off the horse. The horse was running around in circles on the manual.
What did you do to Freya?
I done him in a treble, yeah. 4-1.
This your second?
I was literally just doing it out of amusement, to be honest with you, like just trying to pass a half an hour or two.
So basically off €20 I made 1,000.
Dan got a few winners here.
We got a good few, didn't we? Yeah.
Yeah, you got the baby's look.
Got the baby's nappies for the next year though, but anyway.
The medical team are concerned about the progress of Leonie's labour.
When I'm looking after mums expecting twins, I often comment that you still have to consider the weight of 2 placentas or a single placental mass in the case of identical twins, plus the amniotic fluid in both sacs, and that is a lot for one uterus. You can imagine a prolonged labour and the pressure that that puts on a uterus and the risk of bleeding afterwards.
I'm coming to let you know, right?
When I examined Leonie, I noted that she hadn't progressed, unfortunately. So at that point in time, I recommended a caesarean section as this was the safest option for both her and her babies.
Caesarean, yeah?
Plenty of time there, these two.
Yeah.
She hasn't slept for basically 2 days either, to be honest.
They said, well, there's nothing else we can do here, like, nothing's happening. So they came in and they said, right, we're going to have to bring you in to theatre, and that was when it was scary.
Nothing hurt you. Okay?
So there's only, who is it? Carly, Robin and Caitlin is your bridesmaids?
And Tegan and Cody and Tori.
You've 6? Mother of God, does he have 6 best men? You don't know?
Leonie has been taken into theatre to be prepared for the birth of twins, Nina and Alvie, by C-section.
So I don't know where we heads are all together. I just can't wait to meet them and squish them, but in a good way.
Is okay? Okay. Yeah. Pressure. Keep pushing back. Hey! Congratulations, Leonie. You guys want to have a look?
When you hear the crying noise, it's like I've carried around a silent baby for 9 months, and now I get to hear like the voice.
When Alvie actually came out, I wanted to run to him, and at the same time I had to stay with Leonie, so it was like, okay, Leonie, and then where's Nina?
Hello.
Then Nina came out then, and I was overcome with emotions, and when I seen Leonie crying, then the baby's crying. I was like, Nina was like, what are you doing to me? What are you doing? That's exactly what she thought. She's like, what are you doing? In terms of the joy levels and all that, like one baby is like, you're up there with two, like it's just, you're over Mount
double the
Everest.
reward,
like. I'm trying to open your eyes. It's the most rewarding thing. It's like it was my calling in life, and I know it's Leonie's calling in life, but I just couldn't be happier with the two babies. They're two little beauties, and yeah, I give Leonie the girl. You okay, honey?
I know.
I couldn't imagine having one kid now, and the light that we have too.
Yeah.
You can have a little gentleman and lady family.
Yeah, absolutely, babe.
And I wouldn't change it for the world, would you?
Ditto.
No, ditto.
Don't they? Hey, baby. Don't they, baby?
The luckiest man alive.
It's still not real to me. Overwhelmed. 100%.
Well done, Leonie.
Well done, babe. Couldn't have did it without you.
After a few hours in labour, Sara decided to get an epidural to help her cope with the contractions.
So the contractions are still like happening and everything?
Yeah, absolutely, yeah.
She doesn't feel them.
Second and third baby comes a little bit quicker usually, so.
Oh no, somebody's going for the snip.
Everyone to do it here though.
Yeah. They should have like a little recruitment like table outside. It's like vasectomy.
I always wanted kids. And equally, like for most of the time we've been together, we've had no money.
Yeah. I used to joke about, wouldn't it be cool if we were just like dinks, double income, no kids, and just like hang out.
But we had no income anyway, so.
Yeah, we had no income at the time, so let alone double income.
Sure. Do you want to feel her arse?
Yep. From my perspective, I was kind of like happy with the status quo, so I wasn't actively thinking like, we should have a child, as like pushing it off as like, we'll talk about it after a 5-year wedding anniversary. And I just said that very, very flippantly, and Sara obviously locked it away somewhere, and on the day of our 5-year wedding anniversary, it's like, do you know what you said?
Vishnu's parents live in India. Unfortunately, they haven't been able to visit because of the pandemic.
Oh yeah?
Grand. How's your mum?
Some good. Both them are cheering you on from India.
Is your mum in India?
Mum and dad.
Oh. And have they been to Ireland before?
Yeah. So I was with my folks here.
Oh, very good.
Yeah, for 4 years, and then they
like to come when they get too hot.
Yeah.
I think they always like fantasize about the cold weather, and then they get here and they're like, it's very fucking cold.
They're wrapped up.
Yeah.
My mum and my dad, like, they absolutely love little kids, and they're always kind of like, be like, can't wait for like a little grandchild and stuff. So they were absolutely delighted. It was really, really hard not like physically being able to be with them. My mum was like, if only I could have just come over, moved in, I could just be cooking and helping out and stuff. But
like there was never any question that we were having an Indian baby. Like my spice tolerance went up so high. All I wanted to eat all day was just like jalapenos.
Hi,
I'm Sara.
I'm Maya, nice to meet you.
Nice to meet you.
What's your name?
Sarah.
Sarah, and your son?
Vishnu.
Nice to meet you.
It was lovely to meet you, Sarah.
Bye.
Thanks again.
So nice to meet you. Take care.
Most of the times they are asking us how long it's going to take. But at the end, like as I told to Sara, the birth time is totally unpredictable and things can change really quick.
Yeah, so you are 6 centimeters. Yeah, well done.
I did nothing.
Oh, definitely you are doing. That's great.
Some good news. Your belly button's gone back inside.
No.
Yep.
No.
Yep. Thought you'd like to know that.
Yeah, that is good news.
Yep.
Clive is back in the Rotunda to collect Michelle and new baby, Rio.
We were 8 years until we had Zach, and then 12 years in total until we got to Rio. So our whole married life has been about trying to have a baby, and it's just great.
The last time, obviously, we were in the hospital and it didn't go right, and Zach came out a different way, but it was just relief. Yeah, he'd be 4 next month. We go to the zoo every year for Zach's birthday, but I'm literally in and out in 5 minutes. We go in, we buy a teddy, we go to the wishing chair, leg it. But actually this time we're going to have a little picnic and stuff like that because it's completely different. So we're evolving, and years will change, but he'll always be there, like, you know, always.
Finally. I can't believe we're actually bringing a baby home.
One, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7. Great job.
Okay, good. So we are 8 centimeters, okay?
8
So
centimeters?
that's really good, yeah. And my lady, she's 8, and it's make 2, like nearly 3.
Okay, very thick, is it?
It's getting, yeah, thick enough, yeah.
Is it contractions or nausea?
Nausea.
You getting the shakes with the nausea?
Yeah.
I think Sarah's partner, it's a really supportive mom. Definitely during labor, you need a good support of your partner, and I think they are an amazing couple.
The sound reminds me of the trains in India.
Oh, really?
Yeah. You'd be like trying to doze away to sleep, and then you just have like the sound of the carriages.
Can I go ahead?
Yes. Yep.
Look at me.
I feel nothing.
Yeah. That's lovely. Great, so let's meet this lovely girl.
Okay.
I try and do 3, right?
Yeah, so first a deep breath, then a really long big push, then a deep breath, really long big push again, deep breath, and a really long big push again. Okay. Yeah? Perfect.
You got this.
Oh, definitely you can do it.
Yeah.
Okay, Lisa, I want to start in there.
Oh, okay.
Okay, so take a deep breath and give me a really long big push. That's it, well done.
Keep going,
That's
keep going.
it, that's
keep
it, that's
going.
it, that's it, that's it, that's it, that's it, that's it.
I love that stuff. I love somebody else
Like pushing
screaming
you
or be like, you're
yeah.
almost there, you got one more.
That's it, that's it, that's it, that's it,
Keep pushing, keep pushing, keep pushing, keep pushing.
That's it, that's it, that's it, that's it. Longer, 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 longer.
Now Maya, I love. Maya, I'm like, she has a future career training Olympians.
Amazing, that's it, that's it. Oh, you're brilliant. Well done. Now take a deep breath and go again. Come on. That's a good one. Oh my God, you're nearly there. That's it. Well done. That's it.
I've been a midwife for 6.5 years. I used to own a bookshop. I was a funeral singer, I was a wedding singer, and I taught guitar. And I was a sales rep. I owned a newsagent's shop. I was a waitress, and I worked in an insurance company. I think that's about all the jobs I had. This is my favourite job. Nearly every time a baby's born, even still, I get a lump in my throat. So I used to be terrible. I used to cry an awful lot when they were born, but I don't anymore now because I have too much documentation to do.
That's it. Well done.
Keep pushing, keep pushing, keep pushing, keep pushing, keep pushing.
That's it. That's it. That's it. That's it. That's it. Well done, Sarah.
Got a little tuft of black hair just sticking out.
Hello.
When like part of her hair just kind of like peeked out, I was like, wow, she is almost here.
Do you want to touch the head?
Yeah. Yeah. Look.
Yeah, there.
So squishy!
Well done. So we're getting very close now. Okay, my love, you're doing amazingly well.
Well, there's a giant head sitting in my vagina. The pushing was getting really hard. It's very strange because for something you can't feel, it does exhaust you.
It's now over 70 minutes since Sarah began pushing. The baby is showing signs of distress, and the midwives are hoping that the birth happens as soon as possible.
Mentally, I was kind of aware that this had been going on a while. It's obviously not great for your baby to be sitting in a birth canal forever.
Come on, go for it, Sarah.
Push it, push it, push it, push it, push it, push it, push it. Oh, so close.
That's it, really good. All right, okay.
Not too small piece.
Yeah.
With the neck too.
Yeah. Yeah. She was pushing for a long time and baby was getting a little bit tired. We thought that maybe it was beneficial to give her an episiotomy. That's a little cat. To speed a little bit more. What do you think? Yeah? All right.
You won't feel anything. Basically, it's just to have a little bit of more room.
Nico, he had repositioned my legs and I could feel her. I can distinctly remember feeling her pass through the birth canal.
There's one coming, is there?
Yeah.
You can see baby coming. Go for it.
Go for it, Sara.
I really didn't want an episiotomy. I know
Well done, Sara, that's it. Stop pushing, stop pushing. Well done. Oh my goodness. Well done. Okay. I didn't give you any cut, okay?
The pain's still there. Go for it.
Well done, okay? And give me a little push. I love that moment of the labor. I even sometimes push with them. Well done. Well done.
Look at her.
26.
She came out just covered in poo. I think like maybe 2 seconds, and I think it was the longest 2 seconds to hear her cry.
Oh, hello, little one. Hello.
Sarah suffered from really, really bad heartburn. And like I think one of those old wives' tale is, you know, it's gonna have a hairy baby.
Yeah.
But like we never really paid much heed to that. But when she came out with all of that hair, it's like, okay, that's the heartburn.
Yeah.
You had heartburn during contractions as well.
Yeah, I thought it was such a disgrace that I could feel the heartburn with an epidural. No wonder I was in so much pain.
Already I was head over heels, so she's completely charmed our lives.
Like the love is it's indescribable. Like Vishnu, have you seen her ears? She's got real hairy little ears. Oh, look at their ears.
That moment when she just looks up at you and be like,
And she
"Hi."
focuses on your face. It's the most amazing thing. And like what I find amazing is that it makes me love you more. Yeah, it's like our little baby that we made together, you know. You okay?
Yeah, I'm okay.
But yeah, it's amazing. Like it's so much better than I could ever have anticipated. You know, it's she's perfect. She's absolutely the best thing we've ever done.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out.
Hello!
Oh my god! I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'll do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
I qualified in the heights of coronavirus pandemic, but it's been a strange experience. Like, obviously staffing was a bit all over the place, lots of people out on COVID leave or close contacts, so you really had to step up straight away, take on your role as midwife. There was no easing into the job. People that you work with, when they take off their mask and you're like, oh, that's what your face looks like. Like, I've worked with you for a year, but I don't know what you look like.
With COVID cases fluctuating throughout the pandemic, the level of access to the Rotunda for birthing partners has been limited. Over the past 18 months, restrictions have increased and decreased depending on the level of the virus in the community. Caroline is expecting her first baby. She was induced in the hospital 2 days ago. Her journey to motherhood hasn't been as traditional as she'd hoped.
Growing up, I would have wanted to get married and have 4 kids and not realising the practicalities of that. But you know, when you're growing up and you have this dream, but life, I suppose, it just didn't happen. I did have boyfriends, but they didn't work out.
Now in the delivery room, COVID controls allow Caroline to have her birthing partner with her until after the arrival of her baby.
Your mum is going to be your birthing partner, yeah?
Yeah. I found myself at 38. I'd gotten a house and I had my career, and you know, I thought, you know, time is pushing on and I really need to explore my options before it's too late. So I decided I was going to do it alone because I didn't want to live my life without having a child. So I got a little credit union loan, and I suppose I haven't looked back since.
All right, you just take your time, pet.
Caroline decided to do a cycle of IVF using a sperm donor and was fortunate to become pregnant on her first attempt.
Have you got children? Oh,
I have one.
You're like me, I'm just going to have one and done.
Bit late starting, you know.
Yeah, me too. As part of the IVF process, you choose the sperm donor, and how you do this is through online. So it's a little bit like, you know, online dating, but you're getting a baby at the end of it. For me, it was important that they actually wanted to meet the child eventually, so that was an option as well.
Get things
How old
started.
is your child?
He's 10.
Ah, lovely.
Yeah. Not a bother on him, he's great.
Does he bring you loads of joy?
He really does, yeah. Do you know what you're having, or are you going to leave that as a surprise?
It's a surprise.
Excellent.
Yeah.
Love the surprise.
I have a feeling it's a boy, but you just don't know.
I'm a single mother myself, and I felt that we bonded an awful lot in regards to how it is to be a single parent.
I'm glad I did it.
I'm glad you did too. Because now here we are, we're getting to meet.
Yeah. I think everything is planned out for you, isn't it? Sometimes I feel like the IVF worked, it's just chance, like it just was meant to be. I'm hopeful that eventually I will meet someone. Time will tell, and for anyone who's seen Bridget Jones' Diary, it doesn't mean that I can never meet someone. You know, she had 2 when she was pregnant.
Caroline had hoped to manage her labour with just gas and air, but after 3.5 hours in the delivery suite, she has decided to get an epidural.
Is that a contraction again?
No, that's the
relief.
You know, a few daunting moments are like, oh my God, is it going to be okay? Is the birth going to be okay? Am I going to be a good mother? You know, the usual, but that's all normal.
It's kind of just manipulating the tape up your back, alright?
Yeah. Is the hard work done now?
All done, yeah.
Oh,
So
thanks, Brian.
You're going to feel the benefit of that in about 15 or 20 minutes.
Good morning, our patient's midwife speaking.
Valerie was admitted to the hospital 30 hours ago not long after her first contractions. Because of COVID restrictions, her partner Giovanni has been able to join her for just 5.5 hours each day.
Yeah, he was staying in the hotels for the whole time that I was there. He was just buying the hotels and staying outside, so that when visiting hours were open, he could just come straight away.
This is their first baby. Valerie and Giovanni were together just a few months when they found out that she was pregnant.
It definitely wasn't a planned pregnancy. It wasn't planned.
I was out with my friends, and then she rang me, but I thought she was messing at first. So I hung up, and then she rang me back. She goes, "No, I'm serious. I took the test." And she sent me a picture of the test, so I was like, I just froze and I couldn't talk. It was a very big surprise.
But like we were never like devastated or, you know, like I feel like we never really had like a nervous sort of.
Yeah, no negative thoughts.
Yeah, it was really kind of calm and chill. We met at a party. We were in the bathroom. I don't know why we were in the bathroom, but he got the shower head. We were dressed like. He got the shower head, spilled it all over my hair and makeup. I had a drink in my hand. I spilled it on him. I was like, "What are you doing?" And then I don't know. We just kind of really got along, like.
History after that.
Yeah.
Now that Valerie is in the delivery room, Giovanni can be by her side until after their baby arrives.
When I came into Rotunda with my contractions, I thought that they were bad earlier, and I was texting my mom. I was like, "Yeah, it's like an 8 out of 10." And she was like, "Trust me, that's not an 8 out of 10 if you're able to text still." Like.
With first-time mums, especially when they're that little bit younger, you have to be really patient with them. And kindness, I think, goes a long way. And also just kind of breaking the ice, really.
Giovanni, when you get a chance, would you mind popping out baby's first outfit? Just his hat, nappy, vest and a baby girl, please.
A vest?
The balloon.
Oh, you have them all labelled out.
Yeah.
You're very
Right.
organised. So he's got one. So cute.
Yeah.
Newbie.
I had my 3 children in the Rotunda hospital and they were now grown up. I suppose I would have had empty nest syndrome. I decided to do something for myself and I applied and was accepted as a student midwife. I now concentrate a lot of my time to the women and the babies that we look after, and it's so fulfilling every day. Pandemic has literally upped the numbers amazingly. Each lockdown, we're paying for it 9 months later. It never stops, and so which means I'm never going to be out of work, so I'm happy.
Caroline has been 6 hours in the delivery room. She's hoping her labour has progressed.
Oh,
sorry, no.
You okay? Oh. Okay, so you're actually 9 centimeters.
You're kidding me.
What? Already? I'm already there? Like, I couldn't believe it.
Her mother Vivian is here as her birthing partner.
Hello. Hiya, Mummy's
In
here.
the beginning, Vivian wasn't keen on Caroline choosing to become a solo parent.
When you first said it to me that you were going to get IVF and going to have a baby on your own, I was taken back what you were saying. I didn't know what to think. I remember I said something and your dad told me.
Oh, you always have to be different.
Yeah, it was hard.
Yeah.
It was.
Because it wasn't a sort of done thing.
Because I would be old-fashioned as well.
Caroline's labour has really progressed, but her midwife Pauline is concerned that her baby's head still hasn't descended.
Now I'll get you a drink of water.
She has called in obstetrician Maeve Ogan for advice.
It's always difficult for people when they've been in hospital. Sometimes they'll meet quite a few people. And all of a sudden, you know, she met me for the first time. It is hard for people when they're meeting lots of different people and meeting people at a time of stress, really, for them.
No better woman than Vivian to help break the ice.
I'm Caroline's mammy. We're not alike, believe it or not.
So today you says, "Oh, you can do all the talk," and I was like, "Well, that makes a change."
Would you mind to put the lights on for a minute?
Guess how many minutes I was in here when she was born? You'd love that. You'd love this.
She's a great yapper, great chatter.
You know the railings outside? I lived on the North Circular Road. She was my second. Only young for was 14 months.
Bring her anywhere.
And I have to tell you, she was the best baby in the world. She never woke us.
Caroline wants to cut to the chase, keen for an update from Maeve.
Is everything going okay?
Everything's going fine. The next womb, as you know, is opening up really well. But the problem is the baby's head hasn't come down.
It's not that the baby is necessarily too big, it's just the angle at which it's entering into the pelvis isn't right. Sometimes nature will correct that, sometimes we will correct that, sometimes time will correct that.
Going fine. So what we'll do is we'll examine you at 6 o'clock, okay?
Brilliant.
And hopefully we'll find the baby's head has moved down. Just examine you then and see what the story is.
Thanks so
All right.
much. Thank
We'll
you.
see you later.
Bye. Thank you. Thank you.
Thank you.
Can I tip you? Yeah. Sometimes someone tipping off, it can be annoying.
Ma'am, you think just what you do, just keep your hand on me.
Here, yeah.
Yeah, or on me shoulder.
Yeah, between here and here, yeah.
But don't rub it.
Just put your, that's all right, whatever you're comfortable with.
Yeah.
When you're really tired and you're in a bit of pain, you're just not feeling your 100%, and whoever is closest kind of gets it.
Have you children? Are you
I do. I have a little man.
What age?
He's 10.
That looks really good. I think Caroline's having a boy.
Okay, ma'am.
All right, I know if someone...
Chat.
Okay.
When I'm like this, drives me mad.
Because I'd be trying to help you.
Pressure again.
Valerie has been in labour for 6 hours. With an epidural numbing her pain, it is now just a waiting game.
Are you feeling those contractions?
No.
You've done well, though. You've done well.
Yeah. Thanks, baby.
So is this the first grandchild of your families?
Yeah.
Ah, that's lovely. Must be loads of excitement.
My mum was in 2 places.
Was she not?
No.
And are you living at home with your mum?
Yeah.
And you're 20?
20.
You're 20, oh my goodness.
Yeah.
When I first told my mum, I actually got my little brother, he was 5. I got him to, because I already framed my scan. I did it after my first scan. I framed it and I gave it to him and I said, here, bring that to Ma. And he ran in, he was like, Ma. And then she was like, what is that? And she looked at my sister, because she's older than me, and she's like, is that yours? And she's like, no. And then she's like, Valerie, oh my God. And she was really shocked. Her friends, they were like, that's fine, like, it's a gift, like, there's nothing wrong with it, it's an amazing thing, like. So she was really happy then as well. And I'm 20, like, I'm not a teenager, like.
Oh gosh, she'd be really excited now to be a granny.
She also texted me, she's like, keep me updated.
Say she's waiting patiently at the phone to hear what's going on. And what about yourself, Giovanni? How old are you?
19.
How are you? How do you feel about being a daddy?
Great. I was happy, but when I told my mum, just made it even better because I knew I had people to rely on, and she was excited to be a grandmother.
It's just enough space for your body to curl up.
I'm a huge believer in mums in labour. Once they've got the epidural in, the first thing I say is, do you want to close your eyes and go to sleep?
If you're tired enough, it'll feel really comfy.
And the daddies as well often get forgotten when it comes to the whole process of labour and childbirth. It's not much now, it's just a little yoga mat. But honestly, when you're that tired, I don't think you care.
Valerie and Giovanni have managed to sleep through some of the labour. Her midwife Juby suspects that Valerie may be fully dilated and ready to push.
Turn this light on. Come on, baby. We're ready for you. Sorry, now I'll take that off.
When she was like, okay, it's time to push, I'd wake up, I'd be conscious, I'd be aware, I'd push, and then as soon as she'd be like, okay, the contraction's gone, I'd just fall asleep like I'm dreaming. I don't know what I'm dreaming about, but I'm dreaming. And then it was just the same cycle, like over and over again.
Now there's a lovely contraction there.
Right, go
You
for
want
it,
to go
so.
first? Big deep breath in, right into the bottom. Brilliant.
That's it, babe.
Brilliant. Good. Good.
You got this.
Well done. Nice and slow. That's it. That's it. Well done. Well done.
I seen the head and I was in shock. It was there, like literally happening, and I'm watching, and then just I felt like so blessed.
Yeah. Good.
That's it, babe.
Well done. Good woman. There you go.
That's it, babe.
Well done.
Go ahead.
And open your eyes. Look at your baby. Oh my God. 352. Hello.
And voila, baby was born, and that was it. It was actually almost textbook.
Here's your baby.
My heart opened up and just allowed like something to enter, and just another part of me it's there, and I felt whole.
Now. No, hello, mister. Hi. Having a cough. Good boy.
It's like he's just always been here, like.
Yeah, it's just like he's been somewhere. He's been somewhere with us, like my whole entire life. He's been there.
He almost looks like he's smiling. Look how cute he is. Hi. He's the image of Giovanni. Oh my God.
He looked familiar to me. But everyone keeps saying that he looks like me. But I just think he looks like someone I know, but I don't see him looking like me yet.
You look like your daddy.
He's made me more responsible. There's someone out there that I have to take care of now.
Hello, baby. Hello. I've always wanted a boy, like, my whole life. It just made me feel so, like, whole and, like, just so excited to meet him, like, so. Hello.
We love to see when a mother comes in with her daughter in labour, because you know that she's going to really keep her grounded and calm, and she's been through it before. They know that their daughter is going to be able to do it, and they give them all the support in the world that they need. It's just a different experience when the mother is with their daughter in the labour ward.
I'm with my daughter, I'm worse than the patient. I said I can't. And she's 39, she's nearly there, I hope.
Brilliant.
Yeah.
Well, congratulations in
afraid
advance.
going a bit bit.
You'll be fine.
Yeah.
You'll be fine. Enjoy it.
Consultant Maeve Ogan has been called to check Caroline's progress. Although nearly fully dilated, her labour has stalled.
I suddenly start going into what I felt was like a pain. Things didn't feel right in my body, didn't feel right.
You okay?
Yeah.
We're going to see this baby, okay? But unfortunately, 90% chance it's going to be a caesarean section.
The neck of the womb got to 9 centimetres quite efficiently, but unfortunately baby's head stayed quite high and slightly tilted, which meant that it wasn't moving all the way down the birth canal.
So, what we're going to do, we need to get you pain-free, and then we need to examine you again in the operating theatre, okay? If baby will come normally, we'll do it. All right? We'll do it. Are you okay for us to do the safest thing possible for you? But it just hasn't moved down the birth canal at all.
I have a weird fanny. I knew what
Did you say what I think you said?
Yes.
Ah!
Come
We're
here,
going to bring her, and you can be there.
Can I bring it?
No bother. I'll see you soon.
They're going to bring her to the theatre.
And which room are you? You're in
She's
here.
10 or 11. I'm glad. Come on, it's the face. I tell her, I thought I have the baby myself.
Oh, I know.
Caroline has been transferred to theatre. Although nearly fully dilated, her baby's head still hasn't descended. It has been determined that the safest option for delivery is a caesarean section.
Given everything that was going on, the baby's size, and the long duration of events until that point, the safest thing for mum and baby was determined to do a caesarean section.
So we started.
Ma'am, will you hit my
Sorry.
face? Do you want the head of the bed down?
No, it's coming up.
Okay. It's a gorgeous little boy.
Is the paediatrician in the room, yeah?
Baby was delivered and was just unresponsive immediately after birth.
We're going to get baby over to the baby doctors.
I brought the baby to the Ohio and started resuscitation.
I was waiting and waiting and waiting to hear the cry, and I never heard the cry. I just wanted him to cry so that I knew that everything would be okay.
I was like, oh, come on, Noah, give me a cry. But it just didn't happen that way.
Thank you.
No worries, it's all very straightforward here.
I got something was, everything else wasn't. And I was pregnancy.
Yeah.
You're daddy?
Yeah.
The baby's okay.
Yes. You're okay. You're okay.
The paediatric team has been called in to help with resuscitation.
He's got all the right people around, okay? So all the doctors are there.
Yeah. And then we ended up having to ring up.
Compressions, please. Do the trolley. Do the tube, please.
Which tube do you need?
Oh yeah, waking up a bit. Sats look good there. I'm sure we're getting, we're thinking up there. Have another quick listen. Do we switch towers there?
Looking nice and pink now.
Bitch, John's being here. Apart from that.
You're like, they're okay, they're okay. So the relief that you feel is just incredible.
It's an image of, oh, he's gorgeous. And she the same colour hair as well. Don't let me, isn't he gorgeous? His little face. I'm in love. Oh, when she sees him. Oh, look at him, Caroline.
I'm in love. Are you gorgeous? It's like he's got granddaddy's eyes too. You know me, don't you? Don't I sing to you? It was just amazing out in this world. Just the eyes to look at each other. Hello, man.
Kiss the face off him.
Oh, I still do. We have kissing time.
She still has to pick a name.
It's Connor, Ollie, or Noah.
What you pick?
We'll go with Noah, Mama.
You like Noah, don't you?
Yeah.
Yeah, we want to.
What do you think? Noah, Edward, Brian, Donegan.
So I'm working in the Rotunda now the past year and a half. I work with women during the pregnancy and up to 1 year after the baby's born. The pandemic in the past year has meant that women couldn't bring their partners to their first scan, the 20-week scan now, but at one point they couldn't even bring the partner into that. So they've been kind of doing this whole pregnancy journey on their own. Before the pandemic, your partner was able to be there by your side through the whole journey. Sometimes now they're outside waiting for a phone call in the car so they can come straight in when you're in active labour, which could be hours, you know. A lot of people have felt not traumatised by the birth experience, but by their time in hospital being alone. You know, felt like they were a burden asking the midwife for help, just suffering on their own and on their bedside with their curtains around them. So that's definitely been a huge thing.
Galway native Orla is expecting twins. Her husband James and herself have a 3-year-old boy and are delighted at the prospect of extending their family.
It's only then when you realise when someone says you're going to have twins, like,
yeah.
I knew what it was like to have one, and I was saying, then Like a few people said, like, do you know what twins is like? Like, you're not going to get a minute of them. It's only then when it would hit in, like, God.
And I'm so to tell him that. Thanks so much, Jane. Bye. Bye-bye.
Orla caught James's eye with her enthusiasm for DIY.
Bought a shower off James. I got a discount too, actually. You can tell them then about meeting in a nightclub.
Would you have to come back the second time for the shower door? Because I took something out of the shower door, so I should come back again.
Yes, could he come back to see the shower? But that didn't happen. But here we are, 11 years later.
After 2 years trying for a second baby, Orla became pregnant.
We had our first scan then at 12 weeks. James wasn't allowed into it. So just couldn't believe the midwife was like, we have 2 heartbeats, and I just started bawling, just absolutely bawling. And I suppose the way I looked at it was, oh my God, we're over 2 years trying and now we have 2 babies, which is, again, I kept saying to James, like, we are just so blessed.
At this first scan in Galway, Orla was also told that this would be a high-risk pregnancy. She is now 16 weeks pregnant. Yesterday, a consultant in Galway diagnosed twin-to-twin transfusion syndrome, which puts the survival of both babies at risk.
That was scary, that I probably will never forget. We had to leave Galway University and drive straight to the Rotunda. Quick pack a bag and get on the road. That was a scary journey, probably one I'll never forget, to be honest.
Orla and James need the Rotunda to assess the twin-to-twin diagnosis and see if there's anything they can do to help. Because of COVID infection controls, James has to stay outside in the car.
James couldn't come in, so I went in for the scan and the consultant confirmed that it was 2 girls. And it wasn't the big gender reveal we had hoped for, but I ran out to James in the car and told him that we're having our girls. And I suppose I just prayed and prayed so hard for them. And everyone, oh my God, we have amazing support, don't we? There is candles lighting across the country.
Today in the Rotunda, surgeons will attempt to save the babies with in utero laser surgery. With access for partners confined to a 2-hour period, during which Orla will be in recovery, James has returned home, but will be able to join Orla for a scan in the morning.
Do you know what? Quite lonely. Yeah, it's tough without him. Yeah, it's been a crazy 2 days, to be honest. So he was just able to drop me to the door last night.
The twins are identical, so they share 1 placenta between them. Unfortunately, the babies are not getting an equal share of blood and nutrients.
This is a really serious complication. If it isn't treated, then the risk of one or both babies dying is extremely high. There is evidence of difference in growth between the 2 babies, so one twin is quite a bit bigger than the other baby. Now, at 16.5 weeks gestation, the only option for treatment available to us is to attempt to go in with a camera and look at the placenta, find the blood vessels that are connecting between the 2 babies, and use laser to seal off those connections.
Laser on.
It's kind of too high up here, so if I kind of go along there, yeah, just along the edge of the membrane, okay.
You'll always be thinking of a bad thing. It's just a worry. I wouldn't think I've felt any of this at all when Reese was born, because there was no worry. It was, to us, it was a common pregnancy. To where this isn't. It is a slow waiting game. It isn't nice, but hopefully everything will work out.
I'm going to sell to that. This one.
Laser on.
We keep Orla in hospital overnight and then perform another scan the following morning. And what we're looking to see on that first scan is simply, have both babies survived the surgery?
Now, I'm going to lift your legs up here, okay? Was your plan always to get an epidural?
Yeah, they said to me to get it because of the epilepsy. I take whatever's going out.
Katie and Seamus are expecting their first baby. Katie has a diagnosis of epilepsy, so has been advised by her doctors to have an epidural.
In 2017, I started having seizures and I was in and out of A&E.
it's not the photosensitive type. It's the triggers are more sleep deprivation, stress and stuff like that.
You're very calm. I think it's epidural.
To minimise the stress of an unplanned labour, Katie was induced. Seamus had left the hospital because of COVID restrictions before the induction. They hadn't expected it to work quite so quickly.
They induced me or whatever, and then within 10 minutes the contractions started, and it was just like my stomach was moving, and I was like, oh my God, what is going on? Like, they told me it could be a few days, and it just happened like that. You didn't have time to think?
No, I didn't have time to think. I was panicking. Normally, I'm not a panicky person at all. And it was just like, it was almost like a flop sweat hit me straight away. And then by the time I got to the hospital, she was well dosed with the epidural. She'll fly out.
Yeah.
Here's how
She'll fly out.
fly against the wall.
With his quirky sense of humour, Seamus is doing his best to lighten the mood and reduce any tension.
And what are the chances that it is a monkey? This is what we're hoping for.
A monkey baby?
Yeah. A monkey baby that can talk.
Do you know, he's just one of the funniest people I've ever met.
When did we first met? Probably when I was like 14, you were
Yeah, 14, 15.
Just kind of hung out in similar circles, and I was chasing you a bit, I'd say.
Yeah.
And eventually she
When we
gave
told everyone we were like finally together, and we were like, oh my God, we're going out now. But they were like, yeah, no shit.
Yeah, about time.
Yeah.
Well, look how amazing you did coming over, not thinking that you were that dilated. You're 10 centimetres, your baby's coming.
That's absolute gas, I can't believe it. How long has it even been? Like, it's not...
It must only be about 45 minutes or something, I'd say.
When I came in, I had been told that she was 2 to 3 centimetres, and you're thinking in your head for a first-time mum, you know, it's going to be another good few hours before she gets to 10. So I examined her to see and was so surprised that first baby had progressed so quickly. She was 10 and baby's head was just sitting there, so we kind of had to just get going then.
And Seamus, are you going to cut the course?
Yeah, as long as I can't mess it up, can I?
Are you sure you want to see down there?
Yeah, why not? Bit of crack.
Literally.
James has driven from home in Roscommon to be with Orlaith for a scan. After a critical surgery yesterday, this morning will reveal if both babies have survived.
This is the smaller baby over here, okay?
Thank you.
It's great.
Yeah.
The heart beating away.
Yeah.
And then...
And to hear the 2 little heartbeats the next morning was amazing, wasn't it?
That was, you know, like even when I driving up from the home, like that's all you'd be thinking, just wanting to hear 2 heartbeats, and we were over the moon, like we had got what we were hoping. And we had to come back for a scan on the
Monday morning, yeah.
Still happy to see, knew that we had 2 heartbeats from the Thursday, and we had to go in for the scan on the Monday, and
then things changed.
It is that horrible moment when you look and realise that one heartbeat has stopped. And no matter how much you've told them beforehand that it's a possibility, even if you've told them that the likelihood is really high, everyone always still hopes that that's not what you're going to find.
Unfortunately, the smaller baby's heart has stopped.
when you hear a bit of a silence, it might have been only for 2 or 3 seconds from when you heard the first heartbeat, and you know, them 2 or 3 seconds were the it felt like a long time, and you knew the silence wasn't good. You just freeze.
It was straight away, oh, please let our other baby fight. And my God, she is fighting. She is fighting.
Well done, well done, well done. Let your breath go. Try to direct that more than into your bum, less into your face, as much as you can.
As a person with epilepsy, it's vital that Katie avoids overexhaustion, which could trigger a seizure. Luckily, her labour has progressed quickly, her epidural is working well, and she is very relaxed.
With her history with the epilepsy, you want to limit the amount of time she's pushing. In your head, you kind of have to be looking at her. Is there any signs of a seizure.
Excellent, excellent, excellent. Brilliant, and catch your breath, okay?
Fair fucks you. I'm knackered watching you, to be honest.
Everybody has their own preference about a birthing partner. I like to laugh, so I thought he was actually a really good birthing partner. And for her, I thought he worked really well. He also kind of eased my nerves a little bit as well by, you know, cracking in the joke and keeping her laughing and keeping things calm.
The epilepsy did worry me. I didn't want to say anything to Katie because, like, the less stress on her, the better. If she has a seizure while she's giving birth, what does that mean? What does that mean for the baby? Like, if she can't push and stuff?
Despite the speedy labour, the baby is now showing signs of distress.
So we want to be seeing her head being born with the next few. She is showing signs. You can hear even it's a little bit slower coming back up, you know.
The more that you do it, the more you get a little bit better at hiding that kind of focus and that little bit of apprehension that not everything could go smooth. Things could take a turn at any point.
You can see that much of her head.
Oh my God.
There's a human coming out, you know.
I know. Stop.
She better be sound.
Go on, you're doing amazing. Little bit more, little bit more, little bit more. That's it, one more time again. Fill your...
Katie has only been 2 hours in the delivery room and already her baby's head is crowning.
Excellent, okay, catch your breath. Can I keep your legs like this until the next one? Mm-hmm. Do you want to look at the top of her head, Seamus?
Yeah.
He went down and had a look, so he said it was okay.
Yeah, it was all right, yeah. It's not even a mess down there, all right.
So romantic.
It was beautiful, like, the only word. It was in a weird way, like, it was.
How much head can you see?
Literally, it's coming. I'd say you've two more of them. Just keep.
Would you say that from your experience?
As a midwife.
I feel like you've been a midwife here before.
My midwifery course.
2 more of them yolks you'll have her here. Good on you.
Yeah, you'll be fine. Shoot her out now. Stop messing.
The contraction there now, go on. You'll be laughing her out. That's it. Excellent, excellent, excellent. Go on and go with that, go with that, go with that, go with that. Oh, her little head's out.
Oh my God.
Okay, her head's out. Oh, she's trying to cry already. Can you hear her blowing bubbles?
Yeah.
It's an intense moment, but I think that's like the addiction of the job, that moment you just thrive for. You know, it's you in there, the head's coming, who knows what's next, but like it's happening with the next contractions. Okay. Within a moment, their whole life is just going to be changed.
Push down, that's it. Okay, open your eyes and look down. Oh, thank you!
God.
Congratulations, she's lovely.
No, she came out with like a full head of hair, 7, 8, like, you know, flew out.
Walked out, yeah.
Yeah, he was laughed out.
Oh, hello. Oh, no. Hello. Oh, she's beautiful.
Oh, you're okay. She put her up in my chest and I just thought, like, it's a whole array of emotions. Like, you're a little bit scared, but like you're so happy and you couldn't imagine your life without her, and it's just nuts. And then to look at you and see just like how happy and like scared as well you look. You're okay.
I'm fucking crying now. You hear people always say like, oh, it's an indescribable feeling, like, and it's that like until you're a parent, you know, that bullshit, like. But it actually is. Like, I think I started crying as soon as she came out, and it's just like a flood of emotion.
Oh, you're okay.
You did that.
Oh, some lungs on you.
Oh my God, I can't believe that.
Oh, well done.
I know.
She's perfect, isn't she?
She is perfect.
When she asked me to cut the cord, I was surprised at how gristly it was. It's like a bit of like the fat off a steak or something. And you're like, you have to proper hack through it, like.
Yeah, good on you.
We actually lost it as well.
It's floating around the apartment
Somewhere in the apartment, we don't know, like, so hopefully when we move, we don't want to be leaving that around, like.
That's it, she's detached from you now. She's her own person now.
It is indescribable. You're like, oh my God, you now have to teach them everything, like, and they're going to get to experience everything for the first time, like. It's just mad. It's so mad. It's nuts out here, kid.
Orla and James suffered the devastating loss of one of their twin girls, Leah, a few weeks ago.
A lot of our friends don't realise that I'm still carrying Leah. Just 2 friends actually asked last week, they were like, do you mind if we just, what happened to the other baby? And when I said that I'm still carrying her, they were like, oh my God, we didn't even, like, I suppose people aren't aware.
Clinical midwife specialist Jane will be supporting them throughout the pregnancy with how to cope with the bittersweet feelings of loss and hope.
So I feel so guilty sometimes when I get upset because I still have one lady relying on me.
It is an extremely difficult journey to embark on because you have grief living absolutely side by side with joy. So it's a huge adjustment.
And it's okay to let it all out.
For years to come, we would like to think that Freya's birthday, will be a happy time. And perhaps I might say to them on the birthday cake, other couples have said to me that in this scenario, they've a birthday cake and they might get a little butterfly and they might place a butterfly on the side of the cake. So Freya will know it's a happy day, but she'll always know that there was a little piece of Leah included in it.
The idea of what I'm going to show you today is to encourage you to create memories and have connections. Think about having these for the 2 girls. Okay. And you need to take them, put your smell on them, and then perhaps, when you say your final farewell to Leah, the one goes with her. And then Freya, when she's old enough to understand, you'll say, well, you have a matching comforter. Your sister also had one, and she has hers with you, and you may even at birth put one with one and swap them over.
I suppose Jane, she has been through this with couples and she knows what to say to us, and just to even have the little teddies going home the last day was lovely, and there's one for Reese and one for each girl.
Orla will have regular scans to keep a close eye on baby Freya's progress until her birth by caesarean section.
This baby is flying around, so she is.
I feel we're a lot stronger, and I kind of get comfort in the fact that they're identical twins, so that I will know what Leah looked like. It just gives me a little bit of comfort. And today, we did our scan today, and just to hear that Freya is doing so well, it just means the world.
And there's the 2 little heads together, so see the size difference.
Yeah.
I'll take a little picture of her for you.
Do, please. Yeah.
I get very upset when I start thinking about delivery, because I suppose at the end of the day we're going to be bringing life and loss into the world. But I do know it will be a section, probably around 38, 39 weeks, and I've comfort knowing that it's planned.
Oh, he's gorgeous. I love his hair. I know, mad head of curls, but I did chop it.
You have such hope and sadness, and it's going to be a tough one.
One of the things that I learned early on here was that the provision of life or birth was tantamount to the daily lives of the people I was going to deal with. And they were all affected by the beautiful things in life, but also the death of a baby. That's probably something that is in my own background, because I was a twin and my twin didn't survive. In a different age, admittedly, the attitude was that you had another baby, that you hadn't a total loss. But that was not reflective of the loss that the mother was feeling in terms of that dead baby. In the Rotunda today, that wouldn't happen. Memories are sacrosanct and protected.
Orla is now at full term, 5 months after receiving the sad news about one of their identical twins, Leah.
On that Monday at the scan where we had been told that there was no heartbeat for Leah, the first thing Jane said, and which was actually lovely, was she said, you know what, you should really give baby a name. And it just suited because I said little Leah and fighting Freya.
The couple have plans to honour Leah with a blessing and a burial.
The date that we found out that she wasn't still alive, that marked that day down, and we'll never forget the 15th of March.
15th, yeah.
That, you know, we'll use that as an anniversary for Leah. So.
Yeah.
Oh my God. She's gorgeous. That's what we want to hear, isn't it? Yeah. And a big old stretch there. Fabulous. Oh, birthday.
I suppose you have such hope and sadness, but yet I have to be so hopeful because we have a baby that is dependent on us.
Come on over and meet your little girl. She's gorgeous. Joe? Sweet Joe. I think she's just good. Yeah, she's the red hair and everything. I'm just so glad she's here.
And for Freya, you know, in time, as she's older, she'll have to be explained that she started off life as an identical twin. You know, just to be able to show her that the fight that she has put in to survive.
Oh, hello, gorgeous. Oh, we have been dying to meet you for so long. And Nan's just wondering. I hope you like pink. I hope you like pink. Mommy has lots of pink for you. Oh, you are the cutest little thing.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out. Hello. Oh my God.
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'd do it again.
Events to be remembered and retold for generations to come.
Pandemic babies.
Look at you.
COVID has really brought a lot of changes. People are coming into hospital. There's a lot of PPE gear. There's a lot of people obviously wearing masks. So the anxiety in that in itself really has an effect on the women. I actually really miss seeing grandparents coming in to see their grandkids. There's like balloons, there's flowers, presents, and they're so excited. And there's that like energy of happiness.
With the numbers of COVID cases fluctuating throughout the pandemic, the level of access to the Rotunda for birthing partners has been limited. Over the past 18 months, restrictions have increased and decreased depending on the level of the virus in the community. Tara has been 2 days in the hospital in early labour. COVID restrictions have allowed her husband Neil to be able to join her for 5.5 hours each day. Now that they have made it to the delivery room, he can remain with her until after the baby arrives.
We met through mutual friends at their housewarming party. My friend had married one of her friends and I answered the door to her and got drunk. A couple of hours later I asked her to marry me and we're here now.
I didn't say yes that night, but
I just knew that I wanted to marry her.
Is this a little boy or girl?
A little girl.
A little girl. And what do you have at home?
A little girl.
Fantastic.
Yeah. We make cute girls.
Oh, isn't that great?
They look like their daddy.
Don't they? It's typical, isn't it?
Mother
All
Nature.
the hard work. Yeah.
That's us yesterday.
Oh, look at the. Oh my God, she's a special
image.
Oh, look.
Sure, I love him, so why?
Yeah, well, that's it.
Half the battle.
These gorgeous girls. She'll be spoiled rotten. So, your little girl, what's her name?
Erin.
And who's minding her?
Granny and Grandad.
The love of your life. Your face just lit up. Oh, isn't that great?
She is my rainbow.
Oh, isn't that
She
lovely?
really is.
and my journey to motherhood has been not an easy one.
I'm consistently pregnant for the last 4 years.
God, that can't have been easy. No, very tough.
No, it was.
And you came in here. You were you treated in here?
Yeah, for all of them. So yeah, the first one was as bad as they get, but
we have experienced two very, very hard losses. One where I nearly did die. Unfortunately, our first attempt ended in a miscarriage, and unfortunately complications led to me hemorrhaging quite badly, and I nearly died.
as I told one of the registrars who came to see me on my second natural miscarriage, I said, I'm going to keep trying until you send me home with a baby.
Became pregnant again for a third time, and again it was a different experience. We didn't really exhale for the first 9 weeks until we heard a heartbeat. I quite quickly said I was going to enjoy that pregnancy for as long as it lasted, and fortunately
It went well.
yes, and Erin, our rainbow baby, came in and brightened our entire world.
Yeah, we're so lucky. We're so lucky. Counting my blessings in every possible way.
Watching her thrive has only helped us blossom.
God, it can't have been easy during COVID to be working from home.
We went from straight in and minding a 1-year-old, and then by the time lockdown 3 happened, trying to coordinate a toddler
it was just a completely different experience because like we had a period of creche in between,
Right.
and we got so used to it, and that's part of the reason why I'm pregnant. When the creche has reopened, we made sure that we had husband and wife time. Okay, if we can't go out for dinners and we can't have date nights and we can't have holidays, how can we have us time? And you know, he would always make dinner and I would be dessert. We enjoyed our lunch breaks together.
Oh dear, yeah.
Pandemic babies.
Well, the proof in the pudding is in the dilatation, because so if she's dilating, she's progressing.
Yeah.
You know?
Boston native Ryan is expecting her first baby. She met her partner Patrick just months after arriving from the United States in 2019.
We met on Bumble, and we probably talked for about a week, and then we went on a date, and we just had such a great time. We were together for about 6 months, I'd say, and then COVID happened, and so we went from seeing each other like 2 or 3 times a week to then being with each other all the time.
There was a real high pressure situation, so you learn a lot about people quite quickly. You know, everybody can do it when it's going easy, but you face that little bit of kind of adversity, if you like, bump in the road type thing, and you kind of see what a person's really about. And that was the start of the pandemic, and here we are 15 months later.
7 months after being together in a COVID cocoon, Ryan became pregnant.
It was probably a few days after we found out. I had a little bit of bleeding,
Yes.
and I was really freaked out. And I ended up going to the early pregnancy unit in the Rotunda. So it was my first time going to the Rotunda. We're pregnant for the first time, and I was like, oh my gosh, I feel like something bad's happening because like you're not supposed to be bleeding. And it was really scary because I had to obviously go in without him. So he was waiting in the car, so that was not nice.
Ryan has a genetic heart condition, which makes her pregnancy high risk. She is now 36 weeks pregnant and sees consultant Jen Donnelly every week.
I have hypertrophic cardiomyopathy with arrhythmias. So basically, it's a genetic condition where the walls of my heart get thicker, so my heart gets really stiff and it has a hard time beating. On top of it having a hard time beating, it's beating erratically sometimes. So I ended up getting a pacemaker put in, or ICD put in, when I was 20, I believe, because I kept fainting. It will actually shock me in the way that you would get, you know, paddled. You see it on TV. So that happens inside my chest, which wouldn't be great for me or baby.
So the spine there, so actually the spine is on this side. So you have the lips, the nose, the little fingers.
We know that people with hypertrophic cardiomyopathy are at increased risk of developing complications such as an abnormal heart rhythm or heart failure, sudden death, and other cardiac symptoms such as shortness of breath, and that these during pregnancy can change, particularly around the time of the 3rd trimester and around delivery.
Oh, fantastic. A little 2-page medical history. So that's brilliant. So what we're going to do have here.
I didn't have any bad rhythms or anything after my surgery until I got pregnant. The readings where it showed that I was coming close to having like a heart attack.
How have you been feeling since last week?
In the last week, having a couple of palpitations that made me a little bit lightheaded, and I'm just not sure if it's because I just have extra weight on me.
And how long are they lasting for? Would you say seconds?
Yeah, it's definitely seconds.
And how many times? Like every day?
No, I've probably had it like in the last week, maybe twice.
Twice, okay. But more frequently. That's more frequently than before, isn't it? Yeah. Well, I think because you're seeing cardiologists again next Friday.
Yes.
Right? Yeah. So, I mean, I guess if it was more sustained or if it was happening every day, then come in and we can just give them a call to get them to review things. But okay.
There is a scoring system that's used called the Maternal WHO Risk Assessment Scoring System, and that's a scoring system that goes from 1, which is similar risk to someone without a cardiac condition, to 4, which is someone who would be advised against pregnancy or that they would be at very high risk of complications. Going into the pregnancy, Ryan's risk would have been assessed between at 2 and 3, so kind of mid-range. We try and mitigate those risks, but it's never possible to totally predict what's ahead.
Well, I mean, it was always just a part of our relationship. It was something that had happened in Ryan's past, and from a day-to-day perspective, it's just taking medication. And I think, she takes it in stride. So for me to make it in any way a big deal or a barrier or anything like that would be quite selfish. So I just adopted the approach she took.
Yeah.
It's just part of just part of us, I guess.
Sore.
Tara is hoping to go through labour and to give birth without any pain medication. She knew from an early age that an epidural wouldn't be on her birth plan.
You getting a little bit uncomfortable?
Yeah, it's fast though. It's fine. I breathe through it.
I had a curvature in my spine, diagnosed when I was 7, and I was operated on when I was 11. So I knew from a very young age that I would never be able to have an epidural.
Yeah, and just gas and air just made me woozy. So
Did it? Okay.
I just breath,
You're just going to
like
breathe.
Yeah. That's what I said.
Okay.
If you do nothing else, just remind me to exhale. I do
Don't worry,
tend to.
Neil and I is down there, making sure that you're breathing.
It's like breathe out, Tara.
So I knew if I ever was to become a mother, there would have to be different options. And I always, as I got older, particularly I always wanted to be as strong and as fit and as healthy for when we were ready to have a family, to be able to deliver those babies as naturally as possible and experience my children coming into the world.
But you know, no pain. Yeah, we just get on with it, don't we?
Yeah.
Us women.
Yeah.
Sorry, Neil, it's not just women. I'm sure some men I'm sure are great with
Do you know any?
Aren't we so mean? Yeah.
Neil wouldn't swap with me, would you?
I think we'd be in trouble if the men were having the babies. Yeah.
Spent a lot of time over the last few years challenged with various things between my miscarriages and losing faith in my body's ability to bring life into the world. But particularly after having Erin, she made me feel like a superhero and that there was nothing I wasn't capable of doing.
Have you a name for this little one yet?
We do.
Yeah.
Am I sharing yet?
Oh,
Or are we waiting?
no, wait, absolutely wait.
The
until
big surprise.
She's born.
Yeah.
Lovely. But you easily agreed on it, did you?
Yeah, it was easy because he's very fussy, Terry.
So I have 3 rules for naming babies. The first was the name had to be Irish. The second was it had to be 2 syllables. And then the third was that you had to be able to spell it. So you went for Orla, as it's only 4 letters. And even an American can pronounce it.
No lockdowns.
No. I'll leave you to it.
Could I be sexier?
Although he's a man of very few words, when he talks, he's very, very solid and makes me stop and think.
This one's going to make us work hard, I think.
And you truly, truly bring me the most happiness.
They're all delivered, yeah. So it'll just take a little while. We'll get there. Grant, we'll do them one at a time. Lovely. All right, thank you.
Patrick and his partner Ryan have arrived to the hospital for a scheduled C-section to deliver their baby. The last few weeks of the pregnancy have put Ryan's heart condition and her pacemaker to the test.
I think the extra blood in my body probably put more strain on my heart. I came really close to having my machine go off a few times because one of the chambers is beating really fast and that can put you into cardiac arrest, so it's been crazy.
While in theatre, for safety, Ryan's pacemaker will need to be turned off. The anaesthetic team will take over the monitoring of Ryan's heart.
The ICD is set at a particular rate that it will give a shock to the heart once an abnormal rhythm is detected. And so during an elective caesarean section, we usually turn off this in order to avoid an inappropriate shock.
It wouldn't probably be good for them to have the internal one on and them all get shocked.
Not with a scalpel around a newborn baby. Probably not a good idea to get 10,000 volts up the back.
It's like a parade.
After I will let you see the yeah, okay, and wait when we were ready.
Great, that's
Thank
brilliant.
you so
Thank
much. See you in a minute.
All right, see you in a minute. I didn't feel any anxiety until I woke up this morning. Me personally, when I'm nervous about something, I can feel it in my stomach, almost like it's dropping out kind of thing, like I'm on a roller coaster, you know, at the top of it, about to go over.
If something does happen, they told me that they do have a plan where I would go to the Mater Hospital, and then I think baby would probably just go home with you.
Probably, yeah.
But hopefully nothing like that happens.
Yeah. Yeah.
No, there's no pain, but you can feel like the tugging.
Oh, your chest, are you okay?
It's just a lot of pressure. Remember I had those wires on it?
Oh, yeah.
Bones.
Yeah. Squeeze the turns and have to.
Cases.
Is it normal for her?
Yeah, this is normal. Yeah. More for the head,
Really?
Yeah.
Congratulations.
It's great. I threw up at the beginning, but much better now. And it's just such a relief.
Thank you. Oh, nice.
Lovely size.
Yes.
It's just under 7'5". Oh, the little hat. So cute. Oh, I'm sure he's dying to meet his mummy.
Over the next few days and weeks, Ryan's condition will be carefully monitored as her heart and pacemaker slowly adapt to her no longer being pregnant. Patrick has already begun to adapt to being a new daddy to baby Killian.
What's wrong, little guy?
I'm doing great. He looks very happy there in your arms.
Yeah, as long as he's not crying, I'm happy out.
Oh, you'll have to get used to a bit of crying.
I think so, yeah.
Oh, look at that big
Oh,
white
we
bag.
want some food. Hello. Now what do I do? Squeeze the bottle or just let it go? Oh, he's sucking it.
He'll just suck away. So.
You're sucking away.
Well done.
Thank you.
So there's a 50-50% chance that the baby will have the gene. So the thing is that you can have the gene but not have any symptoms, and they don't know how it's going to develop. It develops differently in everyone.
I'm happy?
Yes.
Yeah.
How are you feeling?
I feel so much better.
Congratulations.
Monitoring is really the most important thing. So we were hoping to get him tested.
Quite early on,
Yeah.
absolutely.
Oh, he's kicking me.
Yeah. It will just be something that in the background, and we may have to deal with in the future, but just to be kind of aware of. And I don't think knowing us that we'd be able to live with not knowing. To be honest with you, you know, some more than others.
Oh, big yawn. This is my time of being a mommy. Oh, come on, give me your Okay, now I'm taking a run.
Tara has been 3.5 hours in the delivery suite without any pain relief. Things are now moving more quickly.
She went from not doing a whole lot to 8 centimetres. She had her first little daughter within 2 hours, and then she bled quite seriously afterwards, and she needed a blood transfusion because of the blood loss.
Memories of Tara's previous delivery are still fresh in Neil's mind.
That jumped to like 44. I was worried. The thing that scared me the most was with Erin the first time round, she ended up having difficulty towards the end. It was kind of important to keep an eye on her heart rate because that's what I vividly remember from the first pregnancy was when her heart rate dropped, and that's when the whole team came in and started rushing around.
That's just picking up mum's pulse, so don't panic.
Oh, God. I really feel like I'm a push.
Yeah.
Where are you?
Tara, I'm going to maybe just very gently examine you and see what's happening, okay? Good girl. Do you feel that pressure now again?
Yeah.
That's it, lift that leg up, put that hand behind your knee. Wonderful, good girl, just like that. Oh, she's just sitting here, beautiful. Well, you're 10 centimetres, Tara, so you're able to just go for it. Just a couple of really good pushes, Tara, with all that pressure, and you'll have her out. Okay. I suspected that this was a bigger baby than her first baby, and she's quite small in stature. That can just make you think, okay, is she going to be able to deliver this baby easily? Could there be a problem? You're okay. You're all right. I know that pressure is getting huge. Good girl.
I work for the catering department, so dealing with the food, the best part for the patients. That's actually amazing how you see this tired face and then all of a sudden the spark in their eyes when they see us coming with the tea and toast. They're like, oh my God, I've been waiting for it. Every morning when we prepare the breakfast and we smell that tea and toast, we're like, why can we not have that? But no, you have to wait for your break.
So you're going to hold on to both legs this time. Good girl, is it starting again? Yeah.
Tara's baby is close to being born. However, the baby's progress through the birth canal has stalled.
She was pushing for quite a while, the baby wasn't moving. And on a second time, Mum, you expect that the baby will progress a little bit quicker. She's sitting there waiting for a couple of good pushes. That's it, Tara, long, steady push now. The head was just sitting there for longer than I was happy with, and I will always call for help. Good girl. Hi. Come on in. Big push. Good girl. Go for it. A little bit of a prolonged acceleration, kind of slow advancement of the head. Good girl. Come on. That's it. Fantastic. Well done. I know that pressure is absolutely huge.
Tara, what we might do is just pop you around on your back and get your legs up just to make a little bit of space, just to see if we can get the baby's head to move a little bit more. Is that okay? Yeah. Well, I just
give you a bit of
try and wiggle yourself into the middle. Oh, you're brilliant. Now, I'm just going to pop you down there. Has it been sat there for a while, Terry?
It's been actually all right, just the last kind of 2 minutes. Another big push again. Tara, chin on the chest and right down into the bottom. So, advancement of the head in the second stage. You're kind of thinking, is there maybe a problem with the shoulders? You get me there, though? Yeah, that's right. Yeah. Tara, I'm going to do a little episiotomy, just baby, but it is still, yeah, absolutely, yeah. It's not something that we routinely do. It's only if a baby is in distress. That's it, Tara, you tell us when you feel that now. Okay, the contraction.
It's just that point, that millisecond of you're exhausted.
Okay, is it starting?
Yes.
Okay, good girl. So a big push down into the bottom.
It's that fight or flight moment that you really do want to give up, but you have to remember that your mind is not in control of this, your body is, and your baby is.
That's it. Big push, yeah. Great. Oh, well done.
Honey.
Well done.
Pass the head.
Big push, chin on the chest. Good girl. Well done. That's it. Good girl. Oh my goodness. Oh, she's just lovely. Now we take this off. Well done. That's what we wanted to hear. Look at that. Well done.
There's just such a wave of relief that washes over you, and euphoria, bliss. I was like, thank God everything went well.
Welcome to the world, Sara.
What's her name?
Orla.
Lovely, gorgeous. How are you going to spell Orla?
O-R-L-A. Yeah.
Keep it simple.
Yes.
Sorry.
We're all about keeping things
Rules
short
free.
and simple.
Yeah. Sorry, I forgot that. Yeah.
To be able to spell it.
I'm so sorry.
We did it. I was very, very grateful to have my beautiful baby girl, just getting to know her and holding on to her and not having that dreaded feeling that I was going to lose another little person.
Get them buttered before they go cold. You know me and my hot toast.
Even through the hard times, you can survive them and you can grow from them and you can help others by sharing those losses. Talk about it and know that it's temporary. You will be okay. The sun will come up tomorrow.
Toast never tastes as good.
Everyone always says that.
The little things are the big things. If the pandemic hasn't taught us that, nothing ever will. You holding on to that boob?
This has been a very different and obviously very challenging year because of the pandemic, more than a year now. This has really restricted a parent's access to spend time with baby, and that is always an issue for us because we think that contact is so critical. I can only imagine how hard that has been for parents. We're really grateful the parents helped get us through this, and we're just delighted that we're able to welcome them back more and more.
For the first 9 months of the pandemic, access for parents to NICU was severely restricted. For Sarah's 8 weeks here, 1 year into the pandemic, she's been allowed to visit for up to 6 hours per day.
But they weren't allowed to touch.
Sara works as a midwife in the Rotunda. She was just under 27 weeks pregnant when she went into early labour.
I was at home and I started getting a few pains. There was just something in me that was like, you have to go into the hospital. But I remember just on the way in thinking, he's 26 weeks and 5 days. I've had 2 babies in ICU already. This can't be happening again. It was literally the second I hit the hospital, the pain started coming every 3 minutes and you could just see the contractions bouncing up and down.
Both of Sarah's older boys were born premature. She was hoping against the odds that Aidan would reach full term.
I went from 0 to 10 centimetres within about 15 minutes. When that all started to happen, Aidan's heart rate started dipping and dipping and dipping. I needed to have an emergency section straight away.
Before Sara went to theatre, she phoned her husband Clive to come and join her in the hospital.
From the time that the bleep went out to him being born was 6 minutes. My husband was able to come in and take photos of Aidan while I was asleep. When I woke up in the recovery room, it was still a very surreal experience. And then obviously Clive had to leave straight away. My husband, he wasn't allowed to go to the ward with me afterwards, so I went up to the ward on my own. I had no baby. I had no kind of knowledge really of what was happening because I was so out of it. And then I didn't get to see Aidan for another 8 hours or so. So it was a very surreal experience to be lying in a bed with no baby, no husband.
Aidan has been cared for in the neonatal intensive care unit for the past 8 weeks.
Hello. Hi, Bubba. Oh, it's okay. It's okay.
I was very naive going into ICU. I thought, oh, he's just going in there for prematurity. He just needs to stay in an incubator for 3 months and that's the only problem. Whereas he had to be intubated, so he had to have a tube down his throat because his lungs were so bad. He had an issue with his heart due to prematurity. We were faced with bam, bam, bam of like, this is what's wrong, this is what's wrong. It's such an eye-opener.
Well, Aidan was born at 26 weeks and 5 days. He's over 13 weeks early and has effectively missed a third of his time in mum's womb. He needed to be instantly supported with his breathing. Aidan then went on to develop much longer-term chronic lung problems. And that happens for babies like Aidan when an immature lung has to breathe for itself and when we need to help them too. But it's very much an intensive care because so many parts of the baby's body need support.
I will always carry that guilt that he is here because of me. You can't help but feel my body failed him and this is my fault.
Sara has been expressing milk every day for Aidan for the past 8 weeks. Her husband Cliff can visit too, but not at the same time, and is limited to 1 hour a day.
Trying to keep it together while he's in ICU, it's a very big juggling act, because the good days are amazing, that you think like there is light and we'll fully come back from this. But then there's the bad days that you're just watching your little baby in an incubator suffering, and you can't hold them and you can't touch them because they're so weak, and they're heartbreaking. Even today, Aidan's had a little setback with his breathing, and I think it's because when you have such a good run, you want to keep running towards that exit. So it can be a very frustrating and disappointing place to be. You're getting all this information constantly. They can progress or they can decline so rapidly that you're constantly getting updates and constantly being told information. And it's very hard to retain because your mind is such a muddle. Your imagination is always the worst.
Can I just get your name again?
Neve.
Yeah,
that's
perfect.
okay.
Yeah.
Don't worry, ask me again if you need.
In the delivery suite, Leonie is in early labour with her first baby. Recent scans suggested that her baby was measuring quite large.
Yeah. What size did they say he was going to be the last time?
I think they were saying like between 3 kilos and 500 grams and 3 and 800.
Yeah. I thought it was going to be like really high up.
Yeah.
It feels okay. Like, you know, like I can feel that his head is there, you know.
I can feel that.
Yeah. Are you a bit nervous?
No, I'm okay at the moment.
Yeah.
Relaxed, yeah.
Yeah.
But I have the history, like the genetic, because I was born when my mom was only 8 months pregnant and I was like over 4 kilos.
Oh, really?
Yeah.
And do you have brothers and sisters?
No, I'm only child.
Oh, okay.
I think she
So you
got
don't know
traumatized.
She was like, never again.
Never again.
Alina came to live in Ireland 6 years ago from Brazil. Just a few weeks later, she met her husband Carl. Now that she's in the delivery room, COVID visiting restrictions don't apply, and he can stay with her until after the baby arrives.
Hi, how are you? I'm Neve. Nice to meet you.
Hi.
How are you?
Good. You're looking great.
Yeah.
It was a long, drawn-out chase. Yeah. Alina was looking for English lessons on Plenty of Fish, and I was an English teacher at the time, so I thought this is my chance to shine. And it took me ages to get a first date, and I got one playing Jenga, but she didn't say a word to me. She was like flanked by 2 male Brazilian friends.
I asked these 2 male friends to come with me because I didn't know what would be the outcome of that date.
Really great chat.
Yeah, so it actually was good because we were all there like as friends, and so I think took a bit of the pressure of like first date.
Where will I put this?
You can leave that over. Maybe, Carl, if you can get some baby clothes out.
Baby clothes, yeah.
He made me to fall in love with him, going slowly and respecting my time. So then I think after a few months that switched a little bit in my mind. They're like, oh, maybe I don't want to keep as a friend anymore. And I saw the way...
Got out of the friend zone. I didn't know I was in the friend zone. Grand.
It's getting real now, huh?
Yeah, this is beginning of my training.
That's it, yeah. You'll be a pro now in a week's time, don't worry.
Well, Leonie's labelled everything for me here already, so...
I know.
Grand.
Just in case. After a few years enjoying our marriage, we start thinking about, oh, maybe we should have a kid, or then think about...
A dog.
Oh, yeah, dog. Yeah, dog first. Yeah, dog came first.
This is not That's Brazilian baby clothes.
Yeah.
While still considering getting a dog, Leonie surprised Carl with some news.
I was away at work, and then when I came home, there was like a pair of little Converse shoes on the bed. I was like, that's not my size. And what's going on?
Yeah.
How are you feeling?
Good. That is a bit of discomfort, but like good.
Then it dawned on me, she's pregnant. You're relaxed.
I am, yeah.
Your jaw relaxed.
Yeah.
My role as a clinical informatics pharmacist would be entirely through the computers. The cyber attack completely took down our capacity. I remember walking in the door of the pharmacy immediately hearing my phone buzz, and when I checked the message, it was Brian telling me about a ransomware attack. It was kind of a dissatisfied exhalation, and then everyone just inhaled and got on with it. Drag out the paper and start going again.
In the delivery suite, Leonie is still in early labour. The medical team are concerned that the baby might be lying in an awkward position for delivery.
She had large for gestational age, which basically meant that her baby was growing greater than the 95th centile. So for first-time mums, this can be a challenge. In Leonie's case, we wanted to decide, is this baby deliverable vaginally? We're going to examine you again, like we did on the ward, and then we'll break the waters. We're going to use the ultrasound just to make sure there's no cord there. So the baby's head is just a tiny bit, what we call it, like bobbing away, so we don't want anything to get in between that when we break the waters. Ideally then you want the top of the baby's head coming down the birth canal. We want to see what's the presenting part. Is it a bum? Is it a head? Is it a face or an ear? The hand.
Hand.
Oh God.
Just by the head. Sometimes the hand can come up by the head.
Like he's relaxing.
Yeah. He's saying, go away. We realised that the baby's head was quite high in the pelvis, which meant that if we were to break the waters on the ward, there was a risk of a cord coming down and it wouldn't be the ideal place for that to happen. So what we do in that case is what we call a controlled ARM, or a controlled artificial rupture of the membranes.
Well done. Yeah.
And the idea is that we put pressure on the top of the tummy and break the waters in a very controlled manner, and we put a lot of pressure down so the head comes into that space.
Sorry,
You're doing great, Babs. Keep calm.
You're doing great. Just take deep breaths here.
When they tried to change his position, this was extremely painful.
I was a bit worried there was something wrong or something. But seeing Leonie, I expected her to be nervous. And then I saw her and she was grand.
Too many of them. Yeah.
And that made me more relaxed then when I saw that.
Yeah.
Keep breathing.
Doing amazing.
Keep breathing.
Having him beside me, remind me to breathe, was really important, was crucial actually.
Oh my God.
Oh.
What a relief.
Huh?
That was so much pressure.
Relax all your body now.
Okay, though.
He's no messer, isn't he?
He's
troublesome like his mother.
Yeah, yeah.
He's a messer,
He's already disobeying his parents anyway.
Yeah.
Yeah. Reminds me of someone.
People who work in the hospital also use the hospital. People start their professional training in the hospital and they grow up in the hospital, and eventually they might have their own children within the hospital. So you view the hospital in a different light when your children have been born there. So we've felt the highs that the people who come through the Rotunda have felt. We've felt the lows that they feel at times, unfortunately, when things don't go well. So we try and provide the care that we expect for our family, for our children.
Sarah's baby Aidan was born extremely premature. For the last 3 months, he's been fighting for his life in the neonatal ICU.
When you have a child in the ICU, you're walking around all the time with this huge amount of stress, and you don't even realise, because you have to carry on. You have to get dressed in the morning, you have to deal with everyday life, you have to come in and be strong. You might have a step forward as in, oh, that hole in his heart is getting smaller. But then now his stomach is bleeding because it has an ulcer now because of that medication. So we just need to fix this one, and then we can turn to that, because look, this one is getting better, this one will get better too. have to remember, this baby was born at 26 weeks.
Oh, oh, big yawn.
Look at everything that he's done.
Hi, baby.
You think of how far he's come.
Look at you.
And I think we're getting there at the moment. Now we get to see his face properly.
Hello.
Aidan is now feeding well and breathing on his own. Sara is excited at the prospect of finally bringing him home.
But he looks fantastic. He just looks like a bigger baby. He doesn't look as crepey or anything. He looks really, he just looks so grown up.
Yeah, it's 11 weeks now today, so
Very busy 3 months, isn't it?
Yeah.
Well, happy birthday for your 11th mark. You'll be deeply disappointed if people stop celebrating the weeks after a while. They all look.
He's made huge progress. He's made massive milestones. So I'm hopeful that he'll be home by his due date.
Look, we peel back the layers a little bit, but
That's
just
it,
the
but
next
it's-
thing is that monitor gone.
Yeah.
You know.
It's
There's a little way to go for him. He, unlike many premature babies, has managed to wean off oxygen, but it took him a long time to do so. Chronic lung disease is something that we always are concerned about, although most babies will manage it very well. There's still a path ahead, but we would be very optimistic that with time, he's going to get there.
Yeah.
Are you dying to get in touch?
Yeah, we are, and meet the 2 other boys and things like that, so it'll be...
Oh, they'll be thrilled as well.
Yeah, they will. They'll be all over you.
Yeah,
All over you.
it'll be lots of love.
Yeah, lots of...
It's great.
So...
Yeah. Oh, look at you. I think you played a blinder. You did fantastic.
Sara is looking forward to using her experience in the NICU to help other parents when she returns to work.
Being pregnant or being a new mum can be the loneliest thing in the world. So to have someone who understands and can comprehend what you're feeling is probably the best support system that you can have, because you're not alone. I know what it's like, and I know it on a personal level now, so hopefully I'll be able to do that for someone. I'm sure with the amount of things that have happened to me, I'm sure there'll be someone I'll be able to help out, but yeah, it'll be brilliant to be able to do that when I get back. Yeah.
Leonie and Carl's baby is lying in an awkward position, which could make it challenging for a vaginal birth.
So yeah, start taking the gas, okay? So start breathing in. Keep breathing all the way through.
Consultant obstetrician Nicola Marr has been called to advise on the safest way for the baby to be delivered.
Unfortunately, your baby has got its head turned, okay?
Yeah. Sometimes during labour we may feel baby's hand in front of the face, or we may feel that baby's forehead or brow is the first presenting part. And when we explained to Leonie that her baby was facing face first as such, she was very understanding of this, and we explained that the safest way to deliver her baby would be by caesarean section.
Yeah, that's okay, yeah, no problem.
When they said, oh, he's not going to change his position, let's go for a C-section, I was really happy. Yeah, let's go, because he's definitely not going to change, and this has been quite painful. And I just want my baby to be delivered in a healthy way and be safe with us.
It's good, isn't it?
Yeah, it's good. It's the best.
Sometimes they just have other plans, huh?
Yeah. Hi.
You're a brave old soldier.
God, he's troublesome, isn't he?
Troublesome.
Off you go. Yeah, go on ahead. Oh. Thank you very much. Now, so it's just in here, Leonie. Just in there.
Here?
Yeah, I'm just in there before.
All of a sudden I was on my own and just left thinking to myself that I was about to become a dad. That little interlude was pretty intense.
just a little drape coming over you now, okay?
You look great, you're glowing again.
Am I?
Yeah.
And light for you. Alright. Just in the middle now, and you're good.
When they brought it in for the C-section, I was pretty nervous inside. Everything's going well.
It's not okay still, thank you.
Sure, yeah. Oh, yes.
Pressure and stretching now for a second.
Yeah? I feel like pressure.
Yeah.
Like moving, but they're not there now. It's
Oh, hello, baby. Who do we have? Big boy. Once you have one shoulder. Yeah, there you go. Yeah. Big boy.
When I saw him for the first time, of course, I just felt like completely in love, and I just thought, oh, he's amazing, such a perfect baby.
So he's 8'8".
He looks like you.
Just checking him over, okay?
Well done, little man. That was tough. Oh, that was tough.
Congratulations! You did so well. Beautiful baby.
Oh. He's great.
Yeah, not a bother, and I'm glad we'll see you now in a few minutes, okay?
I had him there, and I felt like I was in a bubble of this intense kind of experience. Everyone else is like a regular day, and for me it's it's something I remember for the rest of my life. Finish now.